Now we will study about the interior of right atrium. Before going to study about interior of right atrium, I will tell you external features of right atrium once again. See, this is right atrium and it is having the ear-like projection. This is what we are calling right auricle, and it forms the sternocostal surface and it forms the base and it also forms the right border. So these are the different external features which you have studied little earlier. Is it? Then if you cut right atrium wall and if you observe inside, you can see rough part anteriorly, smooth part posteriorly, and the septum which is present in between the right atrium and left atrium. This septum, what we are calling interatrial septum. So when we are discussing about the interior of right atrium, we have to study under three headings. One is rough anterior part, smooth posterior part, interatrial septum. So under these headings we have to study. Now we will see rough anterior part. See here, when we cut and open, this part is projected anteriorly. So this is rough anterior part. Is it or not? So this is rough anterior. How it became rough? See here, just deep to the sulcus terminalis. Here there is sulcus terminalis. No, in the external features you have seen that there is a sulcus. That sulcus what we are calling sulcus terminalis. If you cut wall and if you see inside, you can see one muscular elevation. This muscular elevation what we are calling crista terminalis. This is crista terminalis, right? Then from the crista terminalis, so many muscular ridges directing downwards, forwards and towards atrioventricular orifice. See here, this orifice is atrioventricular orifice. See, this is the atrium and it will be entering into the ventricle through this orifice. This orifice what we are calling atrioventricular orifice. So these muscular ridges extending from the crista terminalis and they are directing downwards, forwards and towards the atrioventricular orifice. These muscular ridges what we are calling musculae pectinata. Musculae pectinata. So this is what we are calling crista terminalis. From the crista terminalis, muscular ridges directing downwards, forwards and towards atrioventricular orifice. These muscular ridges what we are calling musculae pectinata. These musculae pectinata will be extending into the auricle also. See here, if you observe interior of auricle, it is also rough. This is auricle and within the auricle also you can see rough muscular ridges. These are musculae pectinata. So this is about the rough anterior part. This is rough anterior part. Then if it is anterior part, this will be the posterior part. This is smooth posterior part. This is smooth posterior part. In the smooth posterior part, there will be opening of superior vena cava. See here, this is superior vena cava opening. Actually it will be like this. They have cut here. It is like a lumen. They have cut here to open the right atrium. They cut along the superior vena cava. This is superior vena cava opening. Then this is inferior vena cava opening. This is inferior vena cava opening. See here. This is superior vena cava opening. This is inferior vena cava opening. So into the right atrium there will be opening of superior vena cava and inferior vena cava. Along with that there will be one more vein which is opening into the right atrium. See here, this one. Are you able to see this? This one. This is coronary sinus. This sinus is coronary sinus. Coronary sinus is nothing but it is vein of heart. Like remaining organs, heart also having the vein to drain the venous blood from the heart. That vein is coronary sinus. So the major openings are superior vena cava opening, inferior vena cava opening, coronary sinus opening. Along with that, there will be some small veins also will be opening. See here, you can see small holes here.
Yes, sir.
Okay. These small holes, what we are calling venae cardiae minimi. Venae, very simple. Venae means veins. Cardiae means heart. Minimi means small. Small veins of heart. They are not only opening into the right atrium, they will be opening into remaining three chambers also. That means some venous blood from the heart opening into all chambers through these foramens. These foramens what we are calling venae cavae minimi. So smooth posterior part we can also call as sinus venorum. Sinus venorum. Sinus venorum. It is having inferior vena cava opening, superior vena cava opening, coronary sinus opening, and also some small veins opening. These small veins opening what we are calling venae cavae minimi, or we can also call it as Thebesian veins. Thebesian veins. Thebesian veins. Now we will see what are the different features which are present in relation with the superior vena cava, and what are the different features which are present in the inferior vena cava, and what are the different features which are present in relation with the coronary sinus. If you observe superior vena cava opening, just below and behind the superior vena cava opening, you can see SA node. This is histological structure. SA node location is just below and behind the opening of superior vena cava at the upper part of sulcus terminalis. See here, we know that sulcus terminalis. At the upper part of sulcus terminalis, just below and behind the opening of superior vena cava. At this place, we can see the SA node. Then, along with that, just below and behind the opening of superior vena cava, there will be one more projection, one muscular projection. That muscular projection is rudimentary in case of humans, but it is more prominent in case of animals. That tubercle or that muscular ridge, what we are calling intervenous tubercle. There will be intervenous tubercle. Why it is needed? Is it functional in human? It is not functional in human. Why? Our stature is erect stature. That means we will be standing and walking in the erect posture. But in case of quadrupeds, they will be standing on 4 legs. We are standing on the 2 legs. So superior vena cava bed can easily direct it downwards from upper part of the body into the right atrium. No need of any guard. But in case of quadrupeds, blood has to direct towards the atrioventricular orifice, so that there will be one tubercle. That tubercle what we are calling intervenous tubercle. That intervenous tubercle, hopefully, it will be directing the superior vena cava blood towards the atrioventricular orifice. Is it? That tubercle is intravenous tubercle. Is it? So, at least now can you believe all humans are derived from the animal? According to the evolution, all humans are derived from the animals. So, some remnants of animals we are having intravenous tubercle. Not only that, when you are keep on studying, there will be so many remnants are there, animal remnants. So, this is intervenous tubercle. That is rudimentary in case of humans. These two features you have to remember at the superior vena cava, SA node and intravenous tubercle. Then coming to the inferior vena cava opening. See, this is inferior vena cava opening. Is it? See here, this is inferior vena cava opening, and this is inferior vena cava opening here. This inferior vena cava having one valve here. See here, half moon shaped or sickle shaped fold is there. This fold is very clear. See here, half moon shaped fold is there. Is it? It is sickle shaped fold is there. This sickle shaped fold, what we are calling Eustachian valve. This valve, what we are calling Eustachian valve. This Eustachian valve, is it functional now? After birth, there is no use now. But in fetal life, it is useful. It directs the inferior vena cava blood towards the foramen ovale. Here there will be foramen ovale in the fetal life. Right? So, this valve directs the inferior vena cava blood towards the foramen ovale. So, it is functional in the fetal life. So, this valve what we are calling Eustachian valve. This valve is Eustachian valve. Then, if we coming to another opening, what is this opening? This one, coronary sinus opening. This is coronary sinus opening. Is it? This is coronary sinus opening. This coronary sinus also guarded by one valve. See here, I am holding this. Is it clear? Here also one valve is there. Is it clear? This valve is Thebesian valve. Thebesian valve. Why this Thebesian valve is there? Why it is needed here? Because right atrium filled with blood. Which blood? Venous blood. That blood should not enter into the coronary sinus. Actually, coronary sinus blood should be unidirectional. Blood which is present in the coronary sinus has to reach to the right atrium. But right atrial blood should not enter into the coronary sinus. Because of that, this valve is there. This valve. It is also semilunar in shape. This valve is Thebesian valve. Thebesian valve. So this is about the coronary sinus opening. Then here you can see one triangular area. Here you can see one triangular area. This triangular area bounded by anteriorly septal leaflet. Okay, let me tell you about the leaflets first. What is this orifice? Atrioventricular orifice. It is having tricuspid wall or bicuspid wall? Tricuspid wall. So it is having three cusps. See, this is anterior cusp. This is posterior cusp. This one is posterior cusp. And this is septal cusp. Because it is in relation with the interventricular septum. That's what this cusp is. Septal cusp. Anterior cusp, posterior cusp, and septal cusp. And what is this opening? Coronary sinus opening. Okay. Then here one endocardial ridge is there. Here one endocardial ridge is there. This ridge, what we are calling tendon of Todaro. Tendon of Todaro. So here one triangle is there, exactly at this place. This triangle, what we are calling triangle of Koch. K-O-C-H. Triangle of Koch. Right? Recollect boundaries. Anteriorly by septal leaflet. Posteriorly by anterior and medial margin of coronary sinus. Anterior and medial margin of coronary sinus. Superiorly by tendon of Todaro. Superiorly by tendon of Todaro. So that here one triangle is formed. This triangle, what we are calling triangle of Koch. What is the importance of this? Triangle of Koch contains AV node. AV node is located here. That's what it is important. Is it? So AV node is located within the triangle of Koch. Actually, this triangle of Koch is present at the lower part of the interatrial septum. So some textbook they will give that AV node is present in the lower part of the interatrial septum. That is equal to this one only. So this is triangle of Koch. Then see here, this is aorta. Is it? This is aorta. Is it? This aorta having one projection into the right atrium. See here, this is the projection. This bulge into the right atrium because of aorta. So this bulge, what we are calling torcus aorticus. This bulge, what we are calling torcus aorticus. This is a bulge because of aorta. Because of that, this bulge, what we are calling torcus aorticus. Torcus aorticus. These are the different features which are present in relation to the smooth posterior part or sinus venorum. Why we are calling this as sinus venorum? Smooth posterior part embryologically derived from the sinus venosum. Sinus venosum. And rough anterior part. This is rough anterior part. Rough anterior part embryologically derived from the primitive atrial chamber. Primitive atrial chamber. So rough anterior part and also auricle. This is auricle, no? Auricle derived from the primitive atrial chamber. But smooth posterior part developmentally derived from the sinus venosum. Absorbed part of sinus venosum. Absorbed part of sinus venosum. Right? Next, we have to discuss about interatrial septum. See here. This is interatrial septum. This is right atrial chamber. This is left atrial chamber. Now, which I am holding is interatrial septum. This is the interatrial septum. Within the interatrial septum, you can see one saucer-shaped depression. Are you able to see this depression? This is saucer-shaped depression. This saucer-shaped depression, what we are calling fossa ovalis. This depression, what we are calling fossa ovalis. Along the margins of the fossa ovalis, you can see one border. This border, what we are calling limbus fossa ovalis. This margin, what we are calling limbus fossa ovalis. Limbus fossa ovalis develops from the septum secundum embryologically, and fossa ovalis develops from the septum primum. Usually, it must be studied in the embryology when you are discussing about the development of heart. Interatrial septum develops from the septum primum, septum secundum, and septum intermedium. Septum primum, septum secundum, and septum intermedium. So, fossa ovalis is a remnant of septum primum, and the limbus fossa ovalis develops from the septum secundum. Usually, during embryological life, there will be septum primum like this. From above, septum secundum will be descending down. From right side to left side, there will be one oblique passage in between the septum primum and septum secundum. Through this, oxygenated blood from the inferior vena cava enters into the left atrium, from the right atrium to the left atrium. That we will discuss in the fetal circulation. Usually, oxygenated blood from the inferior vena cava first enters into the right atrium. Then, through the foraminal vein, it enters into the left atrium through foraminal vein. Is it? That is needed in case of fetal life. But once we born, no need of this foraminal vein. That time, what will happen? This flaps over the septum secundum, so that this fossa will be remaining. Is it? So this fossa is fossa ovalis, and these margins, what we are calling limbus fossa ovalis. So embryologically, this is septum primum. This is septum secundum. Is it clear? So that is about interatrial septum. So this is about the interior of right atrium.